Hi, I'm Allan Eisemann. I'm the medical director of the Folie Cancer Center at Rutland Regional Medical Center. So I became a doctor because of a real variety of reasons. Most people think that doctors want to help people, which is, I think, pretty basic, and they do want to do that. But in the general scheme of things, there's surgery and all the surgery specialties, and there's medicine and all the medicine specialties. And I knew I wasn't a surgeon. And in medicine, there aren't that many things that are curable. There are a lot of manageable diseases, heart disease, lung disease, diabetes. But when it comes to cancer, often there is a chance to cure people. And when I first started out, much less so, but now we're curing cancers and improving the chances of curing cancers. And it was an exciting area, and there's a lot of research, and there's a lot of science, and then there's also a lot of direct hands-on work with patients and their families. I think the most important things in talking to patients is knowing that they're going to be supported and listened to, and we're not going to abandon them, and that we're partners with them in this whole process. And they want to know they can rely on us, they want to trust us, and we have to give them good, clear advice and good, clear information. And that's really the biggest thing for patients, the biggest thing for us. I like a lot of things about the Folie Cancer Center, but probably the biggest thing is the staff is an amazing group of people. We have people who work in the front office who greet patients and are unbelievably skilled at being happy and funny and helpful. And we have social workers and other people who provide support services. And then we have this very solid group of nurses who are experienced and make people feel comfortable. So the collaboration with the primary care people is frequently over the phone now, because so many of the primary care physicians work in their offices and don't come to the hospital, which is which is something I miss a lot. I used to love seeing the primary care people because the interaction was so helpful. But I talked to somebody today on the phone who had a patient who had CAT scans that were new and abnormal, and I looked at the films and then called the physician back. He was in his office. We talked over what the patient needed. We made plans for additional workup and a referral to another doctor for a biopsy. And then there's going to be follow-up from that, where after the biopsy we're going to have to talk about what plans to make. He knows the person, he's been taking care of him for 15 or 20 years. I'm just meeting the patient, but has a new medical oncology problem. So we're going to work together, and that's something that we do on a regular basis. That's a very typical story. I care for all of our patients in a professional and compassionate manner. I think that shows up for me in a reminder that our patients are people first and they're patients second, and we try to treat them with the dignity that we would want for ourselves and our family. And I think if we keep that in mind, remember that patients are people, they have their own lives and families and worries, it brings us closer together as humans and people rather than doctors and patients.